We're going to do what's called a focus assessment. Do you want to be called April or Mrs. Fulton?
April's fine.
April, could you please tell me your full name and your date of birth?
Yes, it's April Fulton, and my birthday is 6/6/82.
Great, that matches the EHR. Could you also tell me if you have any allergies to medication, food, or environmental allergies?
No, I don't have any.
Great. Before I actually start the focus assessment with April, I would like to ask a few more questions to see if they correlate to the history that I do have on EHR. This might include any prior infections. Rather than ask if they've had specific types of infections, I typically ask the patients, April, have you ever been hospitalized where the medical providers have to wear gowns, gloves, or masks?
No, sometimes they wear gloves.
All right, and that clarifies whether this patient needs isolation precautions and I need to wear PPE. At this point, I also would correlate to the EHR if upon admission there were drains or medical devices noted. She would also probably have an IV inserted at some point. I definitely would be looking at the patency and the IV site at this point to make sure there are no signs of infection, infiltration. April, do you have any medical devices I should know of, such as an insulin pump? I don't see in your history you have an AV fistula for dialysis. You do not have a pacemaker, and no drains or tubes that we know of.
No.
Correct? Great. I've checked your EHR, your electronic health record, for your reason for admission, some past medical history, and labs, diagnostics, pending, or any that are ordered. I would like to go ahead and start with the focus assessment, but I'd like to begin with to ask if you are comfortable. Do you have any pain?
Just in my stomach,
Okay, and can you point to the location of your pain?
like my lower part right here.
And what precipitated or started that pain? Any kind of activity
I think it started after dinner last night.
after eating? Okay. Does it move anywhere?
No, it just stays down in one spot.
Okay, and can you describe the pain? Is it coming and going, stabbing, dull?
It's like cramping.
Okay, coming and going. All right, cramping. And does the pain move or radiate anywhere?
No.
And if you could rank the severity on a numeric pain scale 0 to 10, 0 being none, 10 the worst, what would you rate it?
4.
Okay, and go ahead and clarify for me, when did this pain start? What time?
Maybe about 10 o'clock last night.
Okay, I'm absolutely going to make note of this and make the medical provider aware to see if there are any orders so we can assess and provide interventions. All right, I do also want to just clarify that you do know who you are, identify, do you know where you are?
I'm at the Phoenix College Medical Center
And do you know the reason you're here?
because of my stomach.
Okay, that tells us that she is oriented. I'm going to start also with a little bit more of a neurological check by assessing your eyes. You can look straight ahead, please. And go ahead and look just at the light. Please look at it now. Look at it again. And the acronym we just checked is what we call PERLA. Pupils are equireactive to light and accommodate, which means that they do constrict with a light source. They dilate when the source is removed. Accommodation is the pupils constricting when the light source or object is closer to the face. April, I'm going to go ahead and do assessment of your heart just in one area. Unlike the comprehensive assessment, we're just going to listen to what we call an apical pulse. Providing privacy, I'm just going to apply the stethoscope mid-clavicular, 5th intercostal space. I'm going to listen for lub-dub, S1, S2. If the rate is regular, I will count for 15 seconds and I can multiply by 4. If I do have an irregular rate, I definitely would want to assess for a full minute or compare the rate and rhythm to the baseline assessment or comprehensive assessment to see if that was present at baseline. Again, I would make note of any abnormalities. April, I'm also going to do a lung assessment to assess your respirations. Again, stethoscope to skin, right upper lobe, full inhalation and exhalation. Great. Compare to the left upper. Great. Right middle. Excellent. left middle, and then right lower lobe. I do hear normal respirations. If she's comfortable enough with her abdominal discomfort to sit up, I would assess lung sounds on the posterior part of the thorax as well. All right, April, before I assess your abdomen, I do want to go ahead and palpate the circulation and what we call your radial arteries to make sure that they are equal. Again, a normal rate. The rationale in the focus assessment for only checking radial is if there is a problem, we'd want to move more proximally to confirm there's a brachial pulse. But because she does have good radial pulse rate and rhythm, this is sufficient. I'm also going to check to make sure you have what we call a capillary refill or good circulation into your fingers. April's wearing fingernail polish, so we will go ahead and blanch the fingertip, which means compress, let go. Looking at the clock or your watch, within 3 seconds, we should see recurrence of circulation. In elderly patients, 5 seconds is acceptable. Looks great. April, can you go ahead and grip my hands as strong as you can? This, again, is also an abbreviated neurocheck to make sure the grips are equal and strong. Now, April, I am going to assess your abdomen. I will maintain privacy by pulling down the covers in your gown. Again, we're going to inspect first. We're looking for distension. And also, as we move through each part of the body and system, we would be assessing the skin for color, warmth, lesions, rashes, breaks in the skin, or any scars. Maybe she didn't disclose previous injuries or surgery she's had, and I don't see any. I'm going to go ahead and auscultate what we call bowel sounds. You'll see different patterns. For our skills lab, we'll go ahead and start right lower. I hear nice gurgling sounds. Right upper. Left upper. Left lower. And again, without getting complex, we're assessing to hear if we actually auscultate bowel sounds. The specific concerns that we have when we're auscultating bowel sounds in a focus assessment is if the patient has hypoactive bowel sounds or hyperactive. Hyperactive sometimes are audible without a stethoscope. It could be after the patient eats. There are several disorders that also cause hyperactive bowel sounds that we will review in lecture. Hypoactive bowel sounds can sometimes be a concern to the patient recently had surgery, and if within a certain time period they either have had surgery that has caused a peristaltic obstruction or they've had medications. And the term for this is called ileus. And so we definitely want to check the record for when the patient had surgery or when the patient had the last bowel movement as well. Would need to be reported to the provider if we sense any abnormality. Can you tell me, April, when your last bowel movement was? And was that the typical consistency you have, or have you had any change in your bowel movement?
I've had diarrhea.
Okay, and that's new for you. Again, you'd want to make note of this. That needs to go into the record and be reported to the provider to see if we can provide an intervention for you as well. While we're in the abdominal area, we're also going to assess the urological system since the bladder is in this area. Again, I'm going to inspect, is there any distension? There isn't. I wouldn't necessarily auscultate, but I would go ahead and ask, April, when's the last time you emptied your bladder?
About 30 minutes ago.
Okay, and was it the normal color?
Yes.
Was there any malodor or bad odor?
No.
Do you sense any urgency where you have to urinate but you cannot empty your bladder?
No.
And have you increased in frequency where you're urinating more frequently? All right, so those are good assessment signs. Now I'm going to move down to the lower extremities. So April, so far your assessment has good findings other than the pain that you're experiencing that we certainly will report, but I would like to finish the assessment, so if there's any further information the medical provider needs, we will have it. I'm going to go ahead and uncover. All right. Go ahead and inspect that we do have symmetry to the legs, the calves. One isn't bigger than the other. There isn't any redness. And when I say bigger, any notable swelling. And again, we also review that we're always assessing the skin for rashes, lesions, the integrity, any breaks in the skin, any injuries. April, I'm going to go ahead and assess for the pulse that's on the top of your foot that we call the dorsalis pedis. Just as we did with your radial pulse and your apical, we want to make sure that we do have a normal rate that actually is equal on both sides. Sometimes we cannot always palpate a pedal pulse. You don't want to document no pedal pulse. You do want to obtain what we call a Doppler and go ahead and assess the pulse to see if you can audibly hear it with the Doppler. If you can, my recommendation is to get a sterile indelible marker, mark the site where you did palpate it with the Doppler so that you always know the site to go to. All right, April, we're going to move in here and I want to see how your strength is. All right, so I'm going to push and I want you to resist equally if you can. Great. Pull. And then can you point down as hard as you can? Okay, so what we've checked here is a neuro assessment called flexion and extension, and they're equal. Okay, April, I now want to assess your capillary refill in your toes. Because you have polish on, I'm going to go ahead and compress the skin. I'm going to release and see that the blanching and circulation return within 3 seconds. And again, if you were older, 5 seconds would be acceptable. I've now removed my gloves. I'm gelling my hands, and I'm going to go ahead and ask the patient, April, do you have any questions before I leave the room?
No.
I'm going to make note of some of the abnormalities that I did assess so that we can report to doctor, as I stated, so that we can get interventions that you may need. I do see the call lights within your reach. I do want you to contact us if you need anything or if you experience increased pain. We do have both side rails up. I would like you to use the call light if you do need to ambulate to the restroom. Do you have any questions?
No,
All right,
thank you.
You take care.